student nurse Charmaine Chavez, and I am here to perform the open method of wearing and removing sterile gloves return demonstration. So the purpose of this is to enable the nurse to handle or touch sterile objects freely without contaminating them, and to prevent transmission of potentially infective organisms from the nurse's hands to the clients at high risk for infection. So I already have the needed material here, which is the sterile gloves. Also, I ensure the glove is of the right size. So we have here the size of 7.5 because gloves should be snug and not tight. Also, I can ensure the sterility of the gloves because the packaging is perfectly sealed without any stain or tears. And the expiration date is on March 2026. So prior to the conduct of the procedure, I have to thoroughly wash my hands and observe other appropriate infection prevention procedures. Also, if I'm doing this with a patient, I have to introduce myself and verify the identity of the client and explain what I'm doing and why it is necessary and how can the patient participate. Also, I have to provide some privacy to the patient. So now, to open the surgical gloves, to open the packaging of the surgical gloves, I have to place it to a clean and dry surface because moisture can contaminate the gloves, and also the area must be above the waist level because any object that is held below the waist is considered contaminated. So now to open the packaging of the sterile glove, I have to peel off the outer packaging. And remove the inner packaging without contaminating it. Okay, now I'm going to open the inner packaging and the inner packaging flops so that it won't fold back and contaminate the glove. Now, I'm going to put the first glove to my dominant hand. Since my dominant hand is my right hand, I'm going to use the index finger and my thumb to grasp the folded cuff of the glove for my dominant hand, and for me to insert my hand to the glove, I must keep my thumb against my palm. Okay? And then pull it. Okay, now I can now put the second glove to my non-dominant hand by picking it up and inserting my glove finger under the cuff of the non-dominant glove, and then insert my non-dominant hand. And then pull it. Okay, so since both of my hands are gloved now, I can now adjust the glove to smoothly fit in. Fold the cup. Okay, now I can now remove the gloves by performing the skin to skin and glove to glove principle. So I'm going to grasp the cuff of my dominant hand, glove, and then pull it away, and then hold it with my non-dominant glove hand. And now to remove the non-dominant glove, I'm going to use my middle finger and index finger to insert it under the cuff and pull it away. So now I can now discard this because this is now contaminated. So after performing all of this procedure, I have to wash my hands thoroughly again.